The letter arrives in your insurance portal. Subject: claim decision. You open it. After review, this claim has been determined to not meet criteria for medical necessity. Your doctor ordered this. Your doctor has seen you, examined you, reviewed your history, and determined you need this. A medical reviewer at your insurance company looked at your file for 1.2 seconds, then denied it. The reviewer was a physician. The review was assisted by an algorithm. The algorithm had a 90% denial rate, and the decision was already made before the physician opened your file. You assumed that when your doctor said you needed something, your insurance would cover it. That's what insurance is for. That assumption is wrong in a very specific and documented way. According to a 2023 survey by the American Medical Association, 93% of physicians say prior authorization delays necessary care. Prior authorization. That's the process where your insurance company must approve a treatment before it will pay for it, even after your doctor has already prescribed it. 1 in 4 physicians says a patient has experienced a serious adverse event because prior authorization delayed or denied their care. A serious adverse event means a health emergency, caused not by a disease, caused by a delay. Your insurance company has a word for what they're reviewing when they deny you. They call it medical necessity. The definition of medical necessity is written by the insurance company, not your doctor. By the end of this video, you will understand exactly what prior authorization is and how the denial decision actually gets made. You will know about the algorithm UnitedHealth used to deny hundreds of thousands of claims and the lawsuit that brought it into the open. And you will know the 3 steps of the appeals process that most people never use, and why, when they do use it, they win most of the time. Let's start with how a claim actually gets reviewed. You see a doctor. Your doctor determines you need a procedure, a medication, a piece of medical equipment, or a specialist visit. For many types of care, your insurance company requires prior authorization before they'll agree to pay. Prior authorization means the insurer must pre-approve the treatment before you receive it. This is separate from your deductible, separate from your copay. It is the insurer saying, "We need to decide whether your doctor's clinical judgment meets our criteria for coverage." The AMA's 2023 survey found that physicians complete an average of 43 prior authorization requests per week. Each one takes an average of 13 hours of physician and staff time. That is 1 full working day and a half, every week, for every doctor in the country. Spent not treating patients, spent asking insurance companies permission to treat patients. Kevin is a 41-year-old software engineer in Phoenix. His doctor diagnosed him with severe sleep apnea and prescribed a CPAP machine. That's a continuous positive airway pressure device that keeps the airway open during sleep. Left untreated, sleep apnea increases the risk of heart attack, stroke, and accidents caused by daytime fatigue. His insurance required prior authorization. The request was submitted. 3 weeks later, the response arrived. Denied. Reason: not medically necessary. Here is what Kevin didn't know when that denial letter arrived. The decision was not made by a physician reading his file. It was made by an algorithm, with a physician available to sign off on the output. In 2023, a class action lawsuit was filed against UnitedHealth Group, the largest health insurer in the United States. The lawsuit alleged that the company used an AI model called NH-Predict to generate denial decisions for post-acute care claims. The lawsuit alleged that NH-Predict had a denial rate exceeding 90%. For every 10 claims it evaluated, 9 were denied, regardless of individual patient circumstances, regardless of what the treating physician had documented. A physician reviewer was technically present in the process. According to the lawsuit, those reviewers spent an average of 1.2 seconds per case. 1.2 seconds. That is not a review. Your insurance company didn't deny your doctor's judgment. It denied an algorithm's prediction of your doctor's judgment and called it a medical review. Think of it like a judge ruling on your case who has already received a verdict from a computer and has 1.2 seconds to either stamp it or override it. Almost nobody overrides in 1.2 seconds. Almost nobody can read a medical file in 1.2 seconds. UnitedHealth has disputed the characterization of the algorithm's role in the lawsuit. The lawsuit remains in active litigation as of 2025. What is documented and not disputed? The denial rate was high, the review time was short, and the patients affected numbered in the hundreds of thousands. So now you know what actually happens when a claim is reviewed. An algorithm runs first. A physician follows. Briefly, a letter arrives in your portal. Denied. But here is what almost nobody who receives that letter knows. That letter is not the end. It is the beginning of a process most insurance companies are counting on you not to start. According to the Kaiser Family Foundation's analysis of Medicare Advantage plan data, roughly 1 in 7 prior authorization requests is denied at initial review. Among patients who appeal that denial, the majority have the decision reversed. The majority, more than half of the people who appeal a denied prior authorization claim win. The insurance industry is aware of this statistic. They are also aware of the statistic that sits beside it. Most people who receive a denial never file an appeal. The California Department of Managed Healthcare, which independently reviews insurance denials in that state, found that when patients pursue an independent medical review, a formal appeal to a state regulator, they win roughly 74% of the time. 74%. 3 in 4 patients who took their denial to a regulator had it overturned. This is not a secret. It is a published statistic from a public agency. The system is not designed to be fair. It is designed to be exhausting enough that you give up before it has to be. Kevin waited 4 months through the appeals process. During that time, his untreated sleep apnea worsened. He fell asleep at the wheel on a highway outside Phoenix at 6 a.m. He sideswiped a guardrail. Nobody was hurt. He received approval for his CPAP machine 6 weeks later, after a third appeal, after a letter from his doctor citing the near accident. After 4 months of a condition his physician had determined was medically necessary to treat from day one. The machine cost $850. The appeals process cost 4 months of risk, exhaustion, and administrative effort nobody compensated. The system worked, eventually, at a cost nobody calculated. Here is what Kevin knows now, and what you can use before the process goes that far. First, if you receive a prior authorization denial, request the specific clinical criteria used to make the decision. You are legally entitled to this document. Federal law requires insurance companies to provide you with the criteria they used to determine medical necessity. That document shows exactly where your claim didn't match their thresholds and gives your doctor the specific language needed to write a targeted appeal. Second, file the internal appeal immediately and ask your doctor's office to write a letter of medical necessity that directly addresses the denial criteria, not a general letter of support. A letter that uses the insurer's own language against their own decision. According to the AMA, internal appeals succeed in reversing denials roughly 40 to 60% of the time when accompanied by targeted physician documentation. Third, if the internal appeal fails, file an external independent review request. Every state has a process for independent medical review, where a third-party physician, not employed by your insurer, reviews the clinical decision. In most states, this is free, and the insurer is legally bound by the outcome. This is where the 74% win rate lives. Most people never reach this step because the internal appeal process was exhausting enough to stop them. Don't stop. An algorithm denied your claim. A physician approved the algorithm's decision in 1.2 seconds without reading your file. A letter arrived in your portal calling this a medical review. And a process exists, 3 steps, legally protected, publicly funded at the final level, that reverses these decisions more often than it upholds them. The system is not designed to be navigated. It is designed to end at the letter. Most people let it end there. Now you know there are 3 more steps, and the people who take them win most of the time. If you have a denial letter in your portal right now, don't close it. Note the appeal deadline. Most plans give you 180 days. And call your doctor's office today to request a letter of medical necessity that specifically addresses the denial criteria. The CMS link in the description walks you through your federal appeal rights step by step. It takes 5 minutes to read. It could reverse a decision that took an algorithm 1.2 seconds to make. If you know someone who received a denial and didn't appeal because the process felt impossible, send them this video. The window may still be open. Drop in the comments. Has your insurance company ever denied something your doctor ordered? What was it? Did you appeal? Tell me what happened. Your story is the next person's roadmap. Next week on Body of Debt, why a hospital charges $80 for one Tylenol, and why your insurance company lets them. The question everyone asks and nobody fully answers. We're answering it. Subscribe so you're there.